So a while back, a woman came into my office completely set on Invisalign. She'd already decided. She wanted me to straighten her teeth, and honestly, she was a little annoyed that I wanted to talk about anything else. But the more we talked, the clearer it got that straightening her teeth was going to leave her disappointed because the alignment of her teeth wasn't really the problem. Their size and the spaces between them were. So I talked her out of the very thing she walked in asking for. About 6 weeks later, she left with a smile that she loved for right about the same amount of money she was going to spend on Invisalign from a treatment that wasn't even on the radar. I see that all the time. People come in asking for the popular fix instead of the right one. Today, I'm gonna rank the 7 most common ways people try to fix their smile, from the one I'd put my own name on, all the way down to the one that can wreck your teeth. Some of these are worth every penny. 1 or 2 of them are a waste of money. And the last one, I'm begging you not to try. I'm Dr. Larry Dougherty, and I'm a cosmetic dentist here in the San Antonio area. And I've been fixing smiles for over 16 years. My practice has an oral surgeon, a periodontist, and an orthodontist, all under one roof. So since I see most of these cases every single week, I can be straight with you about what's worth it. One thing before we start, this is general information, not a diagnosis. Nothing here replaces a dentist looking at your actual teeth. Take it as a map, then go get the specifics for your case. Number 1, porcelain veneers. When people hear veneers, they picture thin covers glued over the front teeth just for looks. The version I do is a different thing entirely. A veneer case done properly rebuilds the entire smile in one pass. The color, the shape, the size, the spacing, the worn or chipped edges, all of it together. Nothing else on this list can do that. It does real structural work too, because we can reset how your teeth come together so they stop wearing each other down. Now, the honest catch. It's a real investment and it's a commitment. We shape the teeth to place them. So this isn't something you undo on a whim. That's exactly why it's number 1 though. When you want a real change to your smile and not just a brighter version of it, nothing else comes close. Number 2, Invisalign. And I want to be careful here because Invisalign is excellent. When your real problem is crowding or crooked teeth, moving them into place is the right call, and clear aligners do it beautifully. And yet, for all that, Invisalign is the most oversold treatment on this whole list. Not because it's bad, but because so many people ask for it when it isn't the fix they need. Invisalign moves your teeth. It doesn't change them. So if your teeth are small, or the wrong shape, or discolored, straightening them perfectly just leaves you with perfectly lined up teeth you still aren't happy with. That's the woman from the start of this video. So Invisalign's high on the list, but only for the right problem. It's the right tool for crowding and the wrong tool for almost everything else. Number 3, professional whitening. And this is the most underrated thing on this whole list. For what it costs, nothing else gives you this much. If you like your teeth and you just want them brighter, this is the best money you can spend. But I mean real professional whitening, like core whitening. The system we use is around $1,000. Now, some people balk at that because they're comparing it to strips from the store. Those aren't the same product. Don't worry, I'll get to strips lower on this list. 2 honest catches. It only works on healthy, natural teeth. So if you've got old fillings or crowns on your front teeth, those won't change color. We have to plan around that. And it's for people that like the shape of their teeth already. If you want a different smile, you're back up at veneers. But for the right person, underrated. Every time. Number 4, composite bonding. This is where we use a tooth-colored material to fix small things. A little chip, a small gap, a rough edge. It's more affordable than veneers. We barely touch the tooth. And for the right small problem, it's a great conservative fix. So why is it down at number 4? Because it gets oversold for big jobs. And that's where it falls apart. Using bonding to rebuild an entire smile is like patching a hole with putty when the job actually needs a new wall. It stains over time, it chips, and needs upkeep in a way that veneers don't. So bonding's fantastic when the problem is small, and it's the wrong choice when the problem is big. Match it to the size of the job. So if you're sitting there thinking, okay, but which of these is mine? I made something exactly for that. It's a short smile quiz on my site. A couple of quick questions about what bothers you and what you're hoping for, and it points you toward the treatments worth looking at for your situation before you ever book anything. It's free, and the link is right below this video. Number 5, the whitening strips you buy at the store. And I'll be straight with you about what they are. Strips are a maintenance product. If you've already had your teeth professionally whitened and you just want to hold on to the result, I suppose strips are fine for that. But if you're hoping for a box of strips to give you a real change, you're gonna be let down because they barely move the needle. Strips sometimes get a bad rap they don't really deserve. Just buy them for upkeep, expect upkeep, and you won't be disappointed. Number 6, the Snap-on Smile. This is a removable piece of plastic that snaps right over your real teeth, give you a different look, and then you take it out. Now I'll be fair to it. For someone who genuinely can't do the real work right now, or who wants a temporary look for a specific event, it's got a very, very narrow place. But you gotta know what it is. It's bulky. It doesn't fix a single thing underneath, and if you wear it all day, it can trap food and plaque against your real teeth, which causes its own problem. So think of it as a costume, not a repair. It's that low on the list because it changes how your smile looks without improving your smile at all. You can have a dentist make you one of these things, but I've also seen them on Amazon. I've never made one of these personally, but I've seen some online that were surprisingly decent when you look at them from far away. And number 7, dead last, and it's not close, do-it-yourself at-home stuff. And I want to be clear, these are things I see all over the internet, not things I'm doing in my office. The first is people filing their own teeth down with a nail file or an emery board to even them out. Please do not do this. You cannot grow enamel back. Once it's gone, and you've traded a small cosmetic annoyance for permanent damage and sensitivity you'll be dealing with for good. The second is worse. People are closing gaps in their teeth with little elastic bands they order online. I think sometimes they're called gap bands. Those bands can slide up under the gums where you can't see them, and they can pull healthy teeth right out of the bone. People have genuinely lost teeth this way. There's no version of this that's worth it. This is the one I'm begging you to skip. Now, 2 quick things that didn't make the list, because they're not really treatments you rank, they're the supporting cast. Your gums and your lips. Healthy gums are the frame around the whole picture. No treatment on this list looks good sitting on unhealthy or uneven gums. We always look at how much gum shows when you smile. We look at how your lips sit on your teeth. All of that shapes how any of these dental treatments will look on your face. So we always look at gums and lips too. Surprisingly, they just aren't things that patients think about when they talk to a dentist. So that's my ranking. But it flips the second you know your own problem. Invisalign's number 2 for me. But for someone whose only issue is crowded teeth, it jumps straight to number 1. It's perfect for them. Whitening's number 3. But if you like your teeth and you just want them brighter, it's the single best thing you can do. So for you, it's number 1. The ranking isn't fixed. It moves depending on who's sitting in the chair. Remember the woman from the start? The one who came in certain she needed Invisalign? In her head, Invisalign was number 1. But her real problem was never that her teeth were crooked. It was their size and the spaces between them. So the treatment she ranked first was the wrong one for her, and veneers, which weren't even on her list, gave her the smile she actually wanted in about 6 weeks. A tier list like this is useless until you know which problem is yours. So don't shop by what's popular. Rank your problem first. Do that, and the right treatment ranks itself. So there's the ranking, 1 through 7. And the lesson underneath it all is that your own situation re-ranks the whole list. So if you're wondering whether you're even a good candidate for this kind of work in the first place, I made a whole video on exactly that. How to tell if cosmetic dentistry is right for you before you spend $1. It's right here, so watch that one before you decide anything.